We continue now with our look at REACH Niagara. Today we focus on the partnerships REACH has developed with like-minded organizations that deal with the region's ongoing crisis with homelessness, addiction, and mental health.
I think now more than ever is so important that you're working with community partners. Plain and simple, you can't do it all. You're dealing with a lot of very complex individuals, and also for us as an organization, we only have so many resources. So we're constantly thinking of how do we work together, and that for us too is important because that community member may trust that community partner more than us. And for us though, we acknowledge that. And so how do we find a way to get them to come to us? And that's how you do it sometimes. You build the trust with the partner that they already have a relationship with.
One of those relationships is with Niagara EMS, who established a street outreach team in 2021.
On a day-to-day level, there's really close contact between our street outreach community paramedics and the outreach workers working for organizations such as REACH Niagara, NASO, the Niagara Center of Street Outreach. So they'll have these morning huddles to talk about if they're trying to locate certain individuals, maybe where's the last time someone saw them, what are their unique health needs, social needs, maybe emotional needs, to try and figure out the who's doing what. So it's really daily on the operational level when it comes to collaboration.
Some people believe it's a choice. I have learned through experience that nobody chooses to be homeless. Nobody chooses to be involved in addictions. But because of their past trauma, 100% of people generally have faced some sort of physical or emotional trauma, and it led them to this pathway.
Gateway Niagara and their Niagara Assertive Street Outreach team is another key relationship for REACH. While both groups have clearly defined roles, the situations they deal with for clients can often overlap.
Just as REACH wouldn't work with individuals to house them, we look to REACH to support us in working with individuals who are struggling with addiction. And then from the medical aspect as well, we definitely use the REACH mobile clinics. Our NASO team works very, very closely with the mobile clinics, and it's an opportunity for our staff to bring our sleeping rough population to areas in the Niagara region to get care and support.
A recent partnership with the Niagara Medical Group Family Health Team has led to the creation of a new staff position on the mobile. Everyone that enters the van now has someone who is able to assist them in navigating their way through the healthcare system.
I would say it's definitely helped from a financial perspective. Because one of our staff are on the mobile, we do help with certain financial situations. Like we do provide some funding for gas because they're on the mobile, because it's saving us in mileage for that person driving around, so we assist there. But it's also assisted in the concept of that's one less person they have to hire. It's one less salary they need to find grants for or find funding for, because it's permanent funding for us. So now that's permanent placement for them. So it's a permanent team member for them.
What kind of feedback have you gotten from the navigator? What kind of things have you heard?
The navigator has said that it has opened her eyes to what is actually out there and to the difference that can be made when you're meeting the patient where they're at.
These partnerships have become key to initiating patient success stories and dealing with the growing number of people needing the respective services provided by the organizations who assist the most vulnerable residents of Niagara.
When I first started, everybody was very siloed, separated, and it seems like with REACH and other partners, we're all kind of collaborating because we all have the same goals. We all want to help the unhoused population. We all want to help people with addictions. But it seems as recent, it seems to be everybody is collaborating together to help what's best for the individual that we're working with.
We are seeing more and more people accessing us, and more people than before, where we're seeing, for example, more seniors, we're seeing more families, we're seeing people where it's their first time experiencing homelessness. And so it's not just necessarily those with mental health and addictions, but we're seeing new people come to our system. And so we're thinking for 2024, where else do we need to be?